welcome to the Clinical Consultation Network. As you know, we do this every week at 12:30 Central Time. We even do it more than once a week a lot of times. In year one of doing these, I think we did 55 clinical consultation networks. That's a pretty good record for a year. We did a few fewer this past year. I think we ended up around 108 or 109 between the 2 years we just did this. So we're doing pretty good with the Clinical Consultation Network. And we have us a great guest today. Dr. Dave Buck is with us. And I'm so happy to have him here today because he is going to talk to us about a topic we all need to understand more, which is the needs of people with autism spectrum disorders, particularly children, adults, everybody across the spectrum in their needs. So Dr. Buck is going to talk to us about that in just a moment. Before we do that, though, I'm going to share with you today's Get Smarticle, which is related to this topic. For today's Get Smarticle, I'm going to talk just quickly about this article by Ono et al. About falling through the cracks, how service gaps leave children with neurodevelopmental disorders and mental health difficulties without the care they need. This came out of the British Columbia Medical Journal, and so it's not necessarily a Tennessee-related article, although I think when you see the experiences that this child is having, you're probably related a lot to some of the kids that you have seen, Dave, through the Chattanooga Autism Center, and that others of us have seen through our work. This is a case in point about a person named Emily. Emily is a 9-year-old female with autism spectrum disorder, intellectual disability, separation anxiety disorder, and Tourette syndrome. She wears a helmet, gloves, knee pads because of her severe self-injurious behavior. Her parents have had to stand by helplessly while Emily bruises and batters her head and face. Despite trials of medication by several psychiatrists and community-based behavioral interventions, Emily's self-injurious behavior is worsening. The services that she currently receives, or received at the time that this was written, were psychiatry services. So she gets a tertiary outpatient neuropsych clinic and receives benefits through the Autism Funding Program in their area. Previously, community-based consultants who were not experts in self-injurious behavior were contracted with their Children and Youth with Special Needs program to provide in-home behavioral consultation intervention. These interventions did not change Emily's behaviors. For the past 2 years, Emily's psychiatrist has been strongly recommending she see a behavioral consultant skilled in managing self-injurious behavior be considered for placement in a residential facility specializing in childhood behaviors. And as the behaviors continue and worsen, the mental health of Emily's parents is precipitously declining and their marriage is under a heavy strain. One parent is unable to continue working because of the constant care that Emily requires. Some of the gaps they identified for this particular person, Emily, were lack of communication from the Children and Youth program, initially delayed securing appropriate supports for Emily. While her family now receives benefits through the Autism Funding Program, they get about $6,000 a year, which doesn't cover all the interventions that she needs. Despite the very obvious challenges that her parents face, they have to continuously and tirelessly assert their needs and advocate for their child. And an additional issue for this family has been the requirement to sign a special needs agreement for residential treatment, which involves relinquishing the care of their child with CYSN. This is a difficult step for the family to take, but it's the only way to access a specialized residential program. And Dave, I don't know, this is from British Columbia. This is just an article I found from British Columbia, but we know that this condition exists really all over the United States, that we have gaps in services for people. And so I'm so happy to have you here today to talk to us about this very, very need that we have in the state of Tennessee. And welcome to the Clinical Consultation Network.
Yeah, thanks very much for having me. And on behalf of the people that I serve, anytime we can communicate autism needs to everybody in our community and raise awareness, but also help with inclusion and acceptance of autistic individuals, it's huge. That's what my clients want. And so I want to, before I share, let me just kind of address some of the assumptions I'm going to make in this call because I haven't done one of these before. I'm not necessarily familiar with who all is on the call. But what I'm going to do in this presentation is talk about resources that we are aware of at the Autism Center that people seek because we get at least a dozen or so calls and emails every week from parents, from autistic adults, from case managers, from clinics, seeking a variety of different resources. So what I thought I would do when Trey and Bruce asked me to do this talk is, how about I just list those? A lot of them, I assume most of the people on this call will be familiar with. I also assume that the majority of the people on this call aren't going to care about the specific phone numbers and places that do that in Chattanooga. That's not going to be relevant to you. We can talk more generally. But what I do find interesting is talking about sometimes when there is a lot of those resources available or different ways to get at them. That could be interesting to see how it varies across the state. Or I might mention some gaps that I have in Chattanooga, but maybe you guys don't have elsewhere. And I like things being collaborative. So I would love if you have ideas or things that I missed or questions that you stop me at any point, put something in the chat. If people can monitor the chat and let me know what people are saying, let's do that.
Okay.
I'm also going to go from birth to death. We're going to talk about kids and adults because we work with the entire age range. Also, and I'm not going to do an Autism 101. I think that would be a neat talk, especially from the new neurodiversity movement perspective. But I will mention that you're going to hear me use identity first language. So I'm going to refer to autistic individuals as opposed to people with autism. I work with adults who each have their own preferences. And so what I do is I match their preferences, but there's a fairly decent sized movement in the neurodiversity community to be identity first language. I'm autistic, they might say, or I'm an autistic, use it as a noun. This started in the deaf community, right? Identity first language. So we're seeing it progress. And that's something we can talk about later on too, more of the neurodiversity movement. But I really want to get through resources because my assumption is that's what a lot of these people in this group do is we refer people to resources and we're always looking for more resources for the people we help. Right?
Yeah, that's right. So I want you to get into that, but before you do, I'd like you to just tell us a little bit about yourself, and don't forget to share that interesting fact that was brought to your attention only a few moments ago.
Sure. All right. So I'm a 51, 52-year-old man, married to Dr. Karen Wigley. Some of you know her. She helped start the Chattanooga Autism Center about 12 years ago. And I was a volunteer there for many, many years and just took on a lot of roles, even was volunteer executive director for many years. Then that turned into a small part-time, then eventually a paid position. So I've been doing that forever. My background is in psychology. My PhD is in lifespan developmental psychology. I studied problem solving and reasoning in older adults, among other stuff. Did my graduate work at West Virginia University, seems like a long time ago, and even longer before that is my undergrad was at Northern Michigan University. So here will be my fun fact. My extracurricular fun thing I would do in Northern Michigan University was I was a hooker. So some of you might make that connection, right? I was a hooker. I played rugby.
I forgot to warn you not to do too much information on these days.
Right. So yeah, for those of you who know what rugby is, the hooker is the guy who's in the middle of the scrum and then hooks the ball back in the big scrums and stuff like that. So I played rugby for about 3.5 years when I was in college, just the collegiate sport. Not collegiate, but club sport. So there's my fun fact that probably most of you didn't know about me.
Okay, yeah, I did not know that there was a position called the hooker in rugby, obviously, from my response there, but also, wow, that's a tough sport, man. Rugby, isn't it?
Not as tough as you would think. I'm 5'4" and small guy. I could play it. Anybody can play it.
Okay. Well, thank you for sharing that. That is a great, interesting fact. I really appreciate you telling us about that.
All right,
From there,
then we'll just jump. Go ahead.
I'll just rudely interrupt you several times throughout.
Yes, and yeah, my assumption is that you guys are monitoring the chat or other people are allowed to unmute themselves and they can just throw out a resource or a question at any point, so we can go in those directions. So it's not just me rambling, please.
That's
Because I
great.
want to get a lot out of this as well. So let me just kind of get my screen set here. Give me a thumbs up if you guys can see my first page. Yep, good. All right, so I'm just gonna list, these are things I came up with yesterday off the top of my head that are based on the calls that we get. In no way is this exhaustive. This is not all of the resources that autistic individuals are seeking or needing. These are just ones that I had thought of in the moment, and this is just page one. For anybody who wants to see a more detailed list of the resources in my region, you can go to our website down at the bottom, ChattanoogaAutismCenter.org. And if you go to regional resources, there's a pretty big list there. And on all of those categories, you can drill down and find even more details. So this is just an outline. I'm not going to talk about these in detail now, but most of you should be familiar with, and if not, let me know, but early intervention, right? TEIS, autism diagnostics, we'll talk about that. That can start as early as 12 months. Medical support, we get questions about what doctors to see. Parent support groups are huge. ABA therapy, speech therapy, occupational therapy, respite. These are another big questions that we get. And before I jump to the next page, I give talks about resources to a lot of different groups, and that includes the family practice physicians department at UT. I forget the name of it, but those doctors have me come each year. And it's surprising how many don't know what OT is, for example, or what, actually not surprising, right? That's not their area, but they don't know what ABA therapy is. And so we get a chance to talk about those things. So there's probably most of you on this call know what those are, but not everyone does. And I don't assume that everyone does. We'll mention educational rights, people learning about what they can do in schools to advocate for their child. Therapy, counseling. Again, this type of therapy, different than ABA. This is going to be more for a little bit older kids. Social skills, community integration type stuff. Financial support. I saw Christy Tankersley is on this call. There's others who are doing family support. We'll mention that. Inpatient services, right? That can be a really tricky thing, both for kids and adults. Talk about that. Transition programs. That's where you start to see things start to fade away. There's not as many programs for older kids, and things really start to go away for adults. So what can we do to help people transition? And I don't have it on here, but support groups, support in the workplace, Social Security, things like that. There's so many needs in adulthood, and there are fewer resources and fewer people able to support those needs.
Dave, as you talk about transitional programs in particular, I was previously the director of the Behavioral Health and Intellectual Disability Clinic at Vanderbilt. I'm pointing in this direction as if that's where Vanderbilt is, but I don't really know for sure. But the point I'm making is this one, that we had kids, anybody from the age of 16 and older that came into this program. But so many of them, they were in school till maybe about age 22. And then, boom, after that, the services just fell off a cliff. And we were there to try to pick up the pieces and get people connected, to vocationally and so forth. But this was a huge area that people were experiencing lots of gaps. And I don't have any sense that that's gotten any better since I left Vanderbilt 9 years ago.
Yeah, I've got a slide on that down below. So I would love for different people, including anybody that's at Vanderbilt right now, to talk about that when we get to that slide, because that is a huge, huge need right now. And we can talk about some places that are doing it well too. I have some we can talk about. All right. So early intervention, we at the Autism Center don't interact with early intervention folks as much. And the next slide, when I talk about assessments and diagnostics, will kind of explain that. So if there are severe disabilities evident early on, more families get connected early to the systems that support them, like early intervention. The people who are the service providers come into the home usually and work with the families. They might do a little bit of assessments there, but they can get those families to go to different places to get assessments, help coordinate a few things, give them strategies, help get them connected to different therapies, really lift up that family and get them the sources that they need, because it's really hard to find these things. So those people who get hooked up with early intervention, it can make all of the difference. We have something called Baby University. So pregnant women can get connected to Baby U, and it can work with not just the expectant mothers, but or single dads. It can be anybody can get this service, and it's very similar to TEIS. They work together up to age 5, though, which is really cool. And then the school systems, at least Hamilton County, and most others have different types of ways they do this, but you can bring your child in at age 3 and ask them to do an assessment to see if they qualify for an IEP or a 504 plan. Will they get special education support and accommodations in school or preschool? So many families don't know about this. We're not told or taught this at all. And so this can be a huge help because they might get speech therapy in preschool for free. And also being in school is going to give that child a leg up. A lot of families are like, oh, we're not starting preschool or we're not starting kindergarten until he's 6. So I'm going to wait on that. So when we get families asking about things and they're in this age range or a little before, we really push them to do that. And I know that Hamilton County anyways does a pretty good job. When you get hooked up with PALS is what it's called. Sometimes they'll even do an autism assessment at the school in Hamilton County. Most of the other counties don't do that. So I'm hoping that most people here are familiar. Maybe some of you work in early intervention or definitely refer people to TEIS, I'm thinking.
I'm quite sure we probably have a lot of TEIS case managers on the line with us today, Dave, because Department of Intellectual and Developmental Disability recently took on TEIS. Actually, I say recently, it's been a year ago in July now that we took over that within DIDD. And so we're very closely connected with TEIS at this point.
For us, it's usually the referrals come from them. Those families are starting to maybe see signs of autism, and they might have those families call us, or we talk to those providers, but not always, because a lot of times families won't see some of these signs or doctors until later on. We'll get to that in the next slide. I think we can kind of skip this. You guys all know what it is. I want to spend a little more time on this slide compared to others. So autism assessments, diagnostics. I looked up some research from a couple of years ago, and the average age when people receive their diagnosis is 4.5 years old. But you can do assessments and diagnose autism as early as 12 months. And there's going to be some neat research coming through that's being done both at Vanderbilt and also in Atlanta, Marcus, with some ways to do it even earlier, right? But the thing is, people don't recognize these signs. Even medical doctors who are trained, you don't always see everything. And so they don't get the evaluations until much later. So we'll talk a little bit more about the impact of that. But the way that people do assessments, here's a couple, right? The ADOS is kind of the gold standard. I've been reading up on a new assessment. I'm forgetting the name of it. That is really very fascinating, and I think it's improved over the ADOS, and I think it's getting normed. So it'll be really cool to see that take off. But this is something that is not like other psychological assessments. You're going to go to a clinic. It has to be with a licensed clinical psychologist for it to get reimbursed. You're going to do an intake, so you get established at that clinic. And they might give you some other assessment tools to take home or to give to other family members, or if it's an adult, they have different things they would do. But then you're going to come back usually for 2 different sessions where the licensed clinical psychologist, who has a ton of training in this, is doing the standardized testing that is very interactive. It's not filling in the blanks. And it's not just doing this task, this task, this task. It is quite dynamic because of the range of the spectrum. Some individuals might not be verbal. Some are hyperverbal. Some are 48 years old and some are 2. So these clinicians really have to know what they're doing. So 2 visits, so you get multiple samples of behavior. Then all of that stuff has to be written up, scored, a report is written. You have the individual come back in again to go through that report, to go through the diagnosis. Yes, your child is autistic, level 1, 2, 3, and here's these other things. Or your child isn't autistic, this is what we suspect. And that's done in person or nowadays telehealth, but that is a a long process as well, and very impactful for a lot of people or a lot of families. So that is just so different than how other assessments are done. And I'll mention here that one of the issues is that there's not a lot of psychologists who know how to do this. And the reimbursement rate almost across the boards, TennCare and other providers, isn't enough to cover the costs. So you don't see a lot of places doing it. Our wait list for autism assessments, the last I looked, is about 350 people on it. And I have one person doing assessments 1 day a week, part-time, just a little bit. So there's other places in town who do it. Siskin sees kids 5 and under. There's other places that have long wait lists that are a couple years long. Vanderbilt has pretty long wait lists unless you're much younger. And if you're an adult, there are very few places available to do this. So it's not uncommon for people to wait years to get an autism evaluation. Pausing to let that sink in. Not a lot of people know that.
Dave, we've got a comment down here. Michelle, you want to share that comment from Anita T?
Sure. So, let's see. Some of our schools will provide an educational diagnosis of autism, but that is not the same as a medical diagnosis. That means that the child has to also get a medical diagnosis for therapies to be paid by insurance outside of school. The benefit of the educational diagnosis is for the IEP and the child to start receiving in-school services, since there is such a long waiting list in our area for medical diagnoses.
Great. I'm so glad someone brought up the education versus medical diagnosis. I'm going to get into that in just a little bit because we work with the schools quite a bit here, or as much as we can. I just also want to mention, though, the T-STAT is normed for 18 months to 2 years old, and medical doctors trained on the STAT or T-STAT can do that. I know there's lots of folks in Nashville that are trained on it, but it's only that little window. I looked at our wait list, and I only have 2 people out of the 350 that are in that age range that are on our wait list. So yes, that's early, but they just don't get referred at that point. It'd be wonderful if they did. And then neurologists will also do diagnostic assessments. It's just not the ADOS. They're looking more at level 2, level 3, and doing neurological tests, and they might diagnose someone with autism. But let's get into medical versus educational, right? So like I mentioned with the ADOS.
It's a nice segue that Anita gave you there to test this topic. Anita gave you a nice test this.
Could I ask a question before you proceed?
Yeah.
Okay. I'm an adult who needs an autism evaluation. He's currently inpatient, and they can't put him anywhere else unless, in other words, we can't get him into ECF unless he has an autism diagnosis because his IQ is too high. Okay. So we are trying to get a psychological evaluation done while he is in the hospital, which is technically impossible because that would be duplication of services, right?
Mhm.
But he can't go anywhere unless he gets one. So now the hospital is trying to get a psychological examiner in there and is willing to pay for it themselves if he can stay inpatient long enough. Because the problem is trying to get the provider in while the member is still inpatient. So are there any barriers besides getting this evaluator in? Are there any barriers to being able to do a psychological assessment when the member is in the hospital currently? Would that skew anything?
No, it shouldn't. And I would like to I don't want to overstep here, but here's what I do know. Someone just reached out to us last week or the week before to do something like this, and actually a month ago to come to an inpatient place to do it. The issue for us, I can only speak to the Autism Center, we don't discriminate. We go in the order in which we received requests. So the only way that we go out of order is if someone does a special agreement, forget the term, and contracts us, and then
A special case agreement.
yeah, there you go. And,
Okay.
and they're going to pay us separately and it's this situation. It's not just a family coming in and paying cash, because we put them in the same line as everybody else. And then our clinician is willing to go on site and do that. So we already started that process. And then what happened is that patient, I guess, got moved out and couldn't have the assessment. So we're waiting for that to happen again. I don't know. So reach out to me directly, and we'll get with our clinical folks and we'll start that process again to put that agreement together. But our clinician is willing to do that. It
Oh,
just has to be outside
okay.
of
I
our
know.
normal hours.
I know what happened. Okay, this particular member was inpatient at Moccasin Bend,
Yeah.
and they
So
contracted
you're
with
already working with
you
us. That's
to
us.
come in. But in the meantime, they transferred him out for medical reasons. So now the medical hospital is trying to accomplish the same thing.
Right.
So that's why. Okay.
So that's us. You're talking about us.
Yeah,
So
I
we
guess
are.
so. Yeah.
Let's
Okay.
keep it going. We'll try to make this happen. No one's ever asked us to do this before. We want to, and so we did everything we could to jump through all the hoops to be allowed to do it. So we want to.
Well, here's the issue. Okay. The issue is that every single placement that has ever been tried with this young man has failed, including enhanced supported housing and so forth. Because his TP was not met because of his IQ, the only way he can get the services he needs with ECF is to get this evaluation. So we're hoping that once the evaluation occurs, that he, will meet target population, because if he doesn't, we honestly do not know what to do. Our first inclination was to send him to Springbrook for the autism, but they refused to take him without a conservator, and we cannot do that process for conservatorship, okay? And the grandfather, the only family member, is not willing to be conservator. So we've been unsuccessful with the whole conservator thing. So the only option we have is this evaluation.
Well, we've had a series of Democratic snafus and catch-22s here.
Yeah.
Yeah. But Dave, if I'm understanding correctly, you're serving, so this is an adult person. Your service is available to adults. Is that?
Well,
Yeah, I've got about 100 adults on my wait list.
see,
Okay.
here's what happened. He was in DCS custody in Montana. When he turned 18, they flew him to Tennessee and dumped him on his grandfather, who has no clue how to deal with a young man with these issues. Okay. So the grandfather is no longer involved, and he's the only family member that's.
I appreciate that story with us. I think it underscores some things Dave's talking about.
Yeah, and we just need to continue working together. And I'm glad you shared it, because there are going to be other situations like this, and we haven't figured out solutions yet for them. But I do want to come back to the educational
Thank you so
diagnosis.
much.
Oh, go ahead. Sure. Yeah. I'm looking forward to keeping working with you guys. Okay, so medical doctors can, developmental pediatricians, they might make a diagnosis because of their experience and the person really fits the category, but we get developmental psychologists or developmental psychiatrists refer people back to us to do the ADOS when they're not sure. So that does kind of fall back to that, the psychologist. Now, educational diagnoses, again, I'm more familiar with Hamilton County and a little bit of Georgia. You've got schools that have school psychologists who are trained to do the ADOS. Some of them, most of the rural counties won't have that. Hamilton County does. They are not required to do the ADOS at all. No one can make them do that. But sometimes when either the teachers or the group or the team or the parent suggests that possibly this individual has autism and we think it's having an educational impact, they might do a ADOS and then use that as part of their IEP. Now in Tennessee, autism is not a qualifier for an IEP. If you have autism, you don't automatically get an IEP. And that makes sense, right? There's plenty of autistic students who do not need IEPs. There's plenty who do. So it's deeper than that. Also, in the state of Tennessee, the schools do not have to accept an outside diagnosis. They have to consider it. That's what the legal term is in the law. They have to consider an outside diagnosis of autism, but they don't have to accept it. So we run into that too. we ran into it more in the past in Mark County when we had different leadership, but over the last 4 or 5 years, we've had some tremendous leaders and great changes, and they really like to work in this area much more. It still doesn't mean that everybody gets an assessment whenever they ask. There's still a lot of rules in place there, and it's murky and so on, but that's some of the things that we talk to families about. I think one thing I'll mention, though, is someone had brought up that if you don't have a medical diagnosis, you won't get treatment. And that's not necessarily true in several areas. For example, I'll jump to, so you can go see a doctor without an autism diagnosis and get medication for anxiety if you have anxiety, or if you have attention deficit disorder and they want to see if some medications will help with your focus. I guess that makes sense, you have ADHD, but you can get various treatments without an autism diagnosis, and I'll talk more about those in some other sections. But first, before I get to that, the other thing that we get calls about, not as common as some of the other therapies, but what doctor should I go to? So a lot of people who have kids with developmental disabilities, you want to hook them up with a developmental pediatrician, preferably, a developmental psychiatrist, and in some cases, a neurologist, developmental neurologist. In Chattanooga, we've only got one of each. Dr. Pittman is our developmental psychiatrist. I'm blanking on her name. Melissa is a developmental pediatrician at Siskin. And then Dr. Breen is a developmental neurologist at Erlanger. Now, there might be some others that I don't know about, but we've been doing this a while, and these are the ones I'm aware of. After that, it's other pediatricians who have had enough autistic individuals on their caseload that they feel comfortable. And those parents love to share those names with other parents and help build up, here's where you go to. They treat you well. They don't kick you out of the waiting room and so on. But the other thing we hear a lot more is medicine management or case management. And so I put that sort of under a little bit of the medical needs. So by us, mental health co-op, I don't know if you have those in other parts of the region. We have Omni and McNabb and other places that do medicine management, and they work with a lot of people with disabilities. So that's another place that we refer folks to. And a lot of those places have case management. Sometimes with the mental health co-op, it's required. And so that can be a real helpful thing to get a case manager if you qualify for a case manager. Then you get social workers and other wraparound support. Again, we get that call, but not as much as some of the others that I'm going to talk about. And then once parents find out that their child is autistic, a lot of them want support and have questions. We have a support group here, but it hasn't met since COVID. There's some other, like Family Voices has a support group. I don't know if they've met since COVID. So a lot of things are online. Our Facebook group is really interactive, as I mentioned. We got about 3,500 people on there. Most are from our region. And they love asking, what dentist do you go to who is good with kids with sensory issues? Or what about homeschooling? And so on and so on. They ask all these questions. We post autism-related events on there. It's a great group. And I know there's other groups like that, I assume, in other parts of the region. So those can be really helpful, especially during COVID. Got it. There we go. So then a lot of parents are seeking respite. All the parents will tell you that they are scared to bring their children to regular daycare or get regular childcare babysitter folks. They don't think they will be able to do the right thing at the right moment or be able to handle their child and say things like that. So we don't have any specialized constant childcare that is specific to autism in our region right now. We have an adult day program that is weekly. We have a couple sort of like parent night out, Night Owls and Buddy Break. And we've got a referral network where you can seek childcare providers like babysitters who specialize in autism, but those are one-offs. And we have some summer camps. We really don't have a lot of this type of respite in our region. And when we get to inpatient and stuff like that kind of respite, we're also hurting there too. But you can imagine the impact that good respite, quality respite can have on families. ABA therapy. So this is something that currently most insurance companies are requiring some kind of referral. And And many of those referrals, it needs to say autism, whether they've gotten the ADOS or a doctor is comfortable saying autism on a diagnosis or something like that. That's one of the barriers to getting ABA therapy, unfortunately. And you don't have to be autistic to have some pretty severe behavior issues like elopement and hurting yourself or others or severe meltdowns. And not getting that diagnosis is then a barrier for those families who maybe need the service the most. That's one of the tough ones. And ABA therapy is expensive. So, unless you have good insurance, or TennCare does a good job covering it right now. I hope that stays the case. But it's really intensive too. You're talking 10 plus hours a week. Sometimes it's in the homes of the families. Sometimes it's clinic based. We have a small clinic based ABA clinic. We have actually a lot of clinics in our region. So I would say ABA, even though there are wait lists for it, they're not as big as some of the other services that are out there. I would say that's because currently Tennessee changed its law and it has to be covered under insurance. And currently TennCare covers it at a rate that people can get by. So if that continues, that service is going to be available. I really hope TennCare sticks with that.
Yeah, so for TennCare, persons receiving TennCare, they're able to get this service. The private insurance folks, are they usually able to get it as well, or is it?
Depends on your plan. So you can have Cigna, for example, but which Cigna plan do you have? It might vary across employers. And then you might have copays, which imagine if, this might cost $1,000 a week at least for this therapy. So if your copay is, or whatever your deductible is $5,500, so that puts it out of reach for a lot of families. My hope is that Katie Beckett waiver, now that we have that, I hope some people will be able to use it. They do in other states like Georgia. Katie Beckett waiver helps cover that difference.
It should cover this difference as well in these circumstances. Of course, we're still in the early stages of implementing that, but it should give a lot of families some relief.
Yeah, I haven't seen anyone on our end use it yet by me. So I'd love if other people in the chat can say, yes, I know an ABA client getting ABA and they're using the Katie Beckett waiver in Tennessee. Post that. So I haven't heard it yet. I hope it's going well.
Anita, who commented earlier, just said that it's made a huge impact for the families that we're supporting through Katie Beckett. So Anita, I assume, is one of our case managers through the Katie Beckett program.
So did you say that? Oh, go ahead.
Actually, I'm the director of the Community Development Center, and we have the Children's Center for Autism in South Central Middle Tennessee, and we provide ABA therapy very similar to Dave's program. And we do have some families who have been successfully enrolled in Katie Beckett, and they are using it, which is making it affordable and accessible for them. And I just cannot scream loudly my extreme happiness for these families.
That is so great to hear. So if we have some families that are trying to do that, and if they're hitting some roadblocks, I might reach out so that we can help them get it here as well. No one's needed to yet. Most of our families are TennCare right now, and it covers it.
And these would be Part B people, correct?
Yes. Yes, Part B for us, at least the ones that, so I'm an early intervention provider through TEIS. We have our autism clinic. We're a family support provider. We're an ISC provider, an employment services provider. So we hit the autism spectrum throughout the lifespan as well, and in a different way than Dave's program. But Katie Beckett Part B has impacted early intervention or autism families, and some of those with the autism diagnosis that have been receiving family support, which once they start getting on Katie Beckett, they roll off the family support program, but it still has been successful.
That's great to hear. We're talking about Part B, Dave. Part A being that which is for a narrower group, but provides more funding, and then there's a smaller amount of funding. Is it $10,000 a year? I think that's the amount that comes to mind with that. That's available to families in Part B, which is available to a much wider group of people.
Well, I'm going to jump through to a couple more therapies that we refer people to. We'll get calls from parents saying that their child still hasn't been speaking, not hitting their milestones, and they've been told that they think their child has autism. So we make sure that they get put on wait lists for autism assessment, but we explain that you do not have to wait to get speech therapy. Go to a speech therapist, whether it's in the schools and you qualify there because they're not hitting their milestones, or at a private clinic, and they will probably recognize that there's a neurological thing going on and start working with that child on speech. So we want to communicate that to, and doctors too don't always realize that you don't have to wait for that diagnosis to be done. You do have access to some services. And similar would be occupational therapy, right? They'll do their own evaluations, doing the fine motor skills, or maybe it's sensory issues. They'll recognize a neurological disorder, maybe not necessarily diagnose the child with autism, but they can begin their therapies and help the kids immediately. And that can be in the schools too, for those that provide OT in the schools. So one of the things we do is kind of educate the families about these. Once we hear what their story is and what they're needing, we might say, oh, it doesn't sound like you need ABA. This is more like this. And I would go to an occupational therapist and see if that's a good fit for you, or vice versa. You know, we help talk about those different things and let them explore after that. And then we send them to the website with all of the provider information. The other big call that we get is needing help at school. So sometimes the child is getting kicked out of school. They don't have an IEP yet, or they're struggling in school and the families don't know what an IEP or 504 is. So then we point them to where they can get that training. We talk about it a little bit with them, and we might share some things online, or if there's an event that teaches about it, or at our conference someone talks about it, make sure they go to that. But STEP, the ARC, and then in our area, Family Voices, their consultant over at Siskin is really good at helping people learn about their special needs rights. And there's some others too. There's a Facebook group and so on. But I would say that is one of the big calls that we get. It's tapered since COVID, but I know it's going to come back as the schools, when things finally get back to normal. That's always going to be an issue with our kids. They're going to need special accommodations. So the teachers need better training. They need to understand how they can make accommodations. And then the parents need to know what their rights are and how to work as a team with the schools. And if we want to, we can talk more about, if other people have questions, the diagnosis here. We get a lot of parents saying, hey, they're not giving me an IEP, I need an autism diagnosis. And we're like, well, you can do that. Let's get you on the wait list at all these different places. And then I go through what I explain the law is that it isn't a qualifying diagnosis, and they don't have to accept an outside diagnosis. And sometimes the schools, we hear this, the schools haven't said this to me, but families will say, no, the school told me that I have to get an outside diagnosis. So I'm not sure about that, because the law says differently. And I don't know if that's giving someone the runaround, but I make them say, okay, if I get this diagnosis, will he then get an IEP? Have them put that in writing if they will. But I still think STEP and a lot of these more expert organizations, they're the ones who really can help parents become great advocates, give them the power and the skills they need, and the knowledge to advocate for their child.
Hey, while you're speaking about diagnosis, there was a question asked a little earlier about diagnosis. There are so many people who are undiagnosed, and people within our system, in particular adults who, there really weren't very many resources for diagnosis back when they were in the developmental stage, earlier developmental stages where that might have been a consideration. The nature of the question is it really necessary to get a diagnosis before you start intervening in some of these ways and trying to help somebody with an autism diagnosis? Maybe just characterizing the importance of the diagnosis that people are getting, or whether you can move on beyond that when you suspect that, but yet don't have the assessment to back it up.
Right. And so what we tell parents in that situation is you're going to be waiting. That's a given in our state, in our region anyways. So what can you do in the meantime? And so education is a big thing. Go to the conferences. We have a conference. There's a conference in Dalton. There's other ones. Go to those. Work with other families who have autistic individuals. Go to the internet. Learn as much as you can about autism. And listen to autistic adults. We have a lot of autistic adults on our Facebook group, and just learning from either their postings there or follow them on their social media. And then that can help you understand your own child a lot better. Then we also, at the same time, without waiting, what are some of the needs right now? And some of those you can access while you're waiting for a diagnosis. I don't recommend putting it off because you never know when you might need one. Some teens or young or adults don't have one and they're doing okay. But if they get in a workplace situation where ADA would protect them, if they don't have a diagnosis, they're kind of stuck. They can't claim discrimination for a diagnosis that they have no records of. So we recommend that they do that. We do hear the calls from the folks that are being discriminated against and they don't have any power to do anything until they get that diagnosis. And then that weight of us having this huge wait list is just tremendous, that we can't help them in the moment. And we've got this long list of people waiting. Same for Social Security, disabilities, right? You're going to need more than just an autism diagnosis. I assume you're going to need the full battery. And we get a lot of adults who maybe they were getting by, but they now realize they need that. So that can be really tough to not just get that assessment, but the full list of all the medical things that you're going to need to turn in for Social Security disability. But then I'll mention one other thing that is really helpful. Autistic adults talk about how great it was for them when they learned of their identity. They learned their difference, and it explained a lot. And some are really proud of their identity as autistic. And so that can be a big turning point for a lot of individuals. I also know a lot of young adults who don't like to talk about autism and don't like to identify as autistic. So there's differences in that group. It's not one monolithic group, but for many it is really helpful. And I know others who self-identify as autistic. They're waiting for the diagnosis, but they've done so much research. And other people who talk to them are like, I can't tell you for sure one way or the other, but go ahead and self-identify.
I have a question.
Yeah, go ahead.
Working in in-home services and some of my clients being on the spectrum, it seemed like during like IEP meetings, the school was constantly trying to push an ED instead of autism and I didn't understand like why, but because it seems like it was like a consistent thing. And I was kind of like, I know how schools treat kids with those diagnoses, and I'm not comfortable with this, and the family's not comfortable with this, and the school was just so insistent. And it almost felt like because if they gave her that diagnosis, they would be able to move her to a different school.
I wonder if it's because educational delay or learning disabilities, those diagnoses automatically guarantee you can have an IEP, whereas autism does not.
Well, she already had she had it for other things, but we were also like, yeah. And so they were like, but then she was having all these issues at school that were related to these impacts that she had. And they were wanting to put that diagnosis and move her to a different school in a different county, which actually what happened. But yeah, so I was just kind of wondering like why schools did that and what was the benefit of that opposed to that.
I don't know enough. I bet you
Okay.
it varies a lot. One thing I do want to speak to though is inclusion. Hamilton County 6-7 years ago had the worst inclusion rates in Tennessee for schools, meaning that how much time does a child with an IEP spend in gen ed? And we were putting our kids in special schools and keeping them away from the general education population. And since a lot of changes, we had them come up with a 3-year plan, and they've really improved. And now the goal is, first, let's get the supports in place in every school so kids can go to their home zone school with their siblings, with their neighbors, with their same age peers, be in typical classrooms as relevant. And then only after they have some issues, then you might pull back and look more at CDC or enclosed classrooms, and only when needed. So we're really getting at the least restrictive environment and access to the general ed curriculum and same age peers. So I always makes me bristle a little bit when when the school is pushing to get a kid to another school, but then I don't know the whole situation. What if the school they're in is horrible and they can't make changes that year and they're trying to get that child somewhere where they have a lot more supports for that individual? Okay, maybe that, if all of that is true, maybe that's a reason to move, or the kid thrives there or whatever. But I would rather the school work on changing their own school, getting those teachers trained up and accommodating and team teaching, right? Co-teaching, so the special ed are working with the gen ed teachers and so on. And you can have a much better learning experience and outcomes always. There's a lot of research on inclusive environments.
Okay.
So I know I didn't
Thank
answer
you.
your question. That's my philosophy from doing this for a while in the research.
Well, it's good to hear that that's the direction it's going in, because working in home, it's been a fight in some of these IEPs.
Yeah.
So for
Well,
my and advocacy for my kids.
we learned a lot from Nashville, for example. They did a lot of inclusion about 10 years ago, big leadership changes, and did that. We learned from them how they did it. But when I get calls from people in rural counties and they just say we don't have the ability to work with your child. I mean, legally, I can't believe they're saying that, because legally they have to develop that
Yeah.
ability. But then, what do they do? I don't know. So if you're in a rural area, which most of Tennessee is, in the smaller districts, it's a struggle for sure.
Thank you.
Okay, social skills. Different areas have these different things. We have a cool Minecraft social group where the kids come and play Minecraft, but the people who facilitate it work on interactive discussions and helping people with their feedback and social interactions, things like that. But I also want to say that we have a big job to do to teach the world to be different and to accept people who might talk differently, speak differently. Just because they're different doesn't mean they have to change and fit our way of being social, right? So this is really a two-way street. And I shouldn't say it like that. The environment needs to change a ton for first, if we can. So if we can all work on educating the people around these kids, I think they're going to have a lot easier time making friends and doing what they need to do to get through life. I don't want to spend too much time on this because it's going to be different for different areas. Financial support, Christy, I give a shout out to you, but we do get calls for people who are worried about how they can afford this and that. And so we point them to family support program. We have some local things that are options for rent and other things. Social Security, though, that we find that a lot of people, when they try to apply for disability, they get turned down the first time. So I'm trying to find more lawyers who do pro bono work, or places we can refer people to who are struggling getting on Social Security when they really need it. I'm not an expert in that area, but I'm just saying that's one of the things that we get asked about and have to point people in the right direction. Okay, this is an important issue. We get a lot of calls from, again, usually older. It could be adults. It might be teens or families of kids who are they're showing signs of depression, anxiety, emotional regulation, mental health issues, right? And it really helps if you have counselors who are trained to work with autistic individuals, who accept the autistic characteristics that are going on, also look for strengths in autistic characteristics, and then help people become advocates for themselves, as well as also working on anxiety and depression. But sometimes it's caused by the environment not being accepting of you. And how can we help you advocate and change your environment, change the people around you? So there's not enough of these folks. Our center, we have internship programs. We have fantastic therapists. They're just wonderful. We love that more clinics around do take on autistic clients. We only take on autistic clients in our clinic. And so we have a list on our website of other clinics that we know of that have autistic clients, but there need to be more, especially for adults. Inpatient. This is one where we don't get as many calls, but they are so painful when someone who has developmental disability and a mental health issue, and the inpatient places won't take them. I'll start with kids though. If kids are having severe crises, Chattanooga doesn't have a Springbrook or a Laurel Heights or Norris or we don't have anything like that here where they're going to do either applied behavior analysis or really intensive behavior therapy, bring in the parents and work through this inpatient. We don't have that. We got to send them elsewhere. And then when someone is adult, I mean, yes, there might be some options at one of those places. I forget who takes adults, but if you're having a mental health crisis, and I work with the inpatient folks here. We have some fantastic people, but the places apparently say that they're not trained to also work with this nonverbal person or person who's also autistic and having schizophrenia. They say we can't help them. There's Pasadena Villa out in the Smokies, but what are they $1,000 a week or something like that? I forget what they are, how much they cost. Maybe it's a day. I don't know.
Some hospitals go so far as to exclude people by policy, and this is not a good situation. I think that we're in. I do wonder sometimes if this is if an inpatient hospital setting is always the best setting for somebody to get stabilized, and so I think that in addition to considering inpatient, as you bring out here, residential is important consideration, because it may be that this is not the thing that's best treated within a hospital always.
No, but you're still going to need a bed. So like if they need to go to Erlanger Behavioral Health or Moccasin Bend or somewhere to stabilize that individual, I see the solution as, I think those places would be willing or could get talked into their staff receiving more and more training until they say, all right, we are ready to take on autistic individuals, and then they will. And so providing that training and continuing to work with other groups who are dealing with the crisis management stuff and them getting that training. I think Alexa, stop. Sorry. I think that's I think that'll be one of the solutions there. It's just gonna be a lot of work. But I think we're gonna move in that direction.
Yeah.
I will mention that Orange Grove has an intensive outpatient program. So it's outpatient. So I can't remember if it's 3 days a week, but they're there for several hours at a time. Pretty intensive. So it's a lot of time. And it's in between inpatient and a 1 day a week visit to your therapist. So I'm really excited about that. We've got it up on our website. So Orange Grove IOP program. Love to see.
In Haywood, over in the western part of the state, in the Jackson area, has developed an intensive outpatient program as well. So this is a concept that's starting to grow, and I couldn't be more pleased.
I don't have many slides left, so real quick, the schools are, at least our school is doing a little bit better with transitioning students who are high schoolers and have IEPs. What do we need to do? What are you going to be doing after you graduate? So they're hooking them up with employers or volunteers, or sometimes with Voc Rehab or other programs, so that they know what they're going to do that day after they leave high school. Or maybe it's getting them hooked up with disability departments in the local colleges. For us, it's UT Chattanooga or Chat State. They both have strong, really strong actually, disability departments. Chat State didn't used to, and now they really have grown it. And Mosaic at UTC is one of the top in the country. So it all depends on what your goals are, but you have to get those parents and kids to focus early on, and then there has to be something in place, and the schools really need to be on it in their IEPs. I'll mention so along with that, employment. We got a lot of folks calling that they can't keep a job, they struggle finding a job, or sometimes it's the parents calling for their adult children. And that gets really tricky. ECF Choices is an option that I think a lot of you guys know about. Voc Rehab, they're getting better and better at working with autistic individuals. I'm going to brag on a program we have called Stages. Young adults, autistic adults, again, don't need to be diagnosed, who are wanting to move out of the house and live on their own, or at least become more independent. And so we've got direct care staff who work with those individuals on their individual goals, not the parents' goals, those individuals' goals. Sometimes it's employment, sometimes it's just being able to care for yourself better or do certain things that you want to do in life. So it's a neat program, and we are in network with ECF Choices, but that is so tough because they don't reimburse for a lot of the stuff that the program does. They're very narrow, so it's hard to fund that program, and not everybody can pay for it out of pocket, so it's tricky. So, but all you guys have access to Voc Rehab. You all know what ECF Choices is, so that can pay for various programs, job readiness, job coaching, transportation, so on.
Yeah,
Just that.
you know, I made that comment earlier about school to adult transitions, but actually ECF is something that's now available that was not available at that time, which has helped a lot of people over the course of these last several years.
Yeah, it was so needed. The thing that hopefully they will evolve into is they need to reimburse better, and there need to be, and they can't affect, well, that will impact the number of providers that are out there. They can't make someone be a provider. However, if the reimbursement rate was there, there would be more providers. And so imagine if you're living in a rural area, you have ECF Choices, but there is no one around you that can provide the service. So, I think the only way around that is, I mean, we need to build capacity, build more people skilled at doing this job, but got to raise the pay. Otherwise, no one's going to do it. I shouldn't say no one. It's going to be harder to get quality people out there doing it who will stick with them. Our stage staff love it though. They love their job, and real strong crew. There are adult support groups. A lot of them are online. We've got a group called Greater Chattanooga Aspies. It's run and created by autistic adults. Now they have a lot of online meetings. Used to do more in person, bowling, outings, things like that. They have a Facebook group, and they started a symposium that is modeled after our autism conference, but it's all adult autism topics, and they run it all themselves. Fantastic group. So look them up, refer people to them. There's also Southeast Neurodiversity Alliance. I think they're online currently, COVID, but that's a wider ranging group, very inclusive. So hopefully, and I know, I forget what it is in Nashville, if it's Tennessee Families, Tennessee Autism. I know there's a decent adult group out there too. I'm sure there's others that I'm not aware of. My slide kind of stops at these adult resources. All the adults love to show me how these resources and needs do not go away. They need psychiatrists. I can't think of one psychiatrist in our area who specializes in autistic adults. They complain that there's not enough medical doctors that understand them because they don't have their pediatrician anymore. And the therapists aren't trained in autism. And what about the employers, and so on and so forth. There just needs to be a lot more resources, and we're slowly chipping away at that. But I see that as one of the biggest needs, that and autism assessments, finding ways to increase capacity so we can get that wait time down for especially the older people who can't get into the places with the shorter wait lists. So I felt myself rushing there. I wanted to get through all of these things. I will stop. I don't know if I'm out of time now.
Well, we are out of time, but man, I do appreciate you so much coming on and talking to us about these things. I think it's very educational for everybody in our audience to hear that.
Yeah. Well, thanks for you guys for sticking with me for all this time. Sorry I went over.
That's all right. Don't worry about that too much. And everybody, appreciate you being here. This is the Clinical Consultation Network. As you know, we do this every week, 12:30 Central Time. So join us again next week for the CCN. And again, thank you, Dave. Really appreciate you very much.
Glad to be here. Thank you all.